Looks like we have a very small group today, but that's great. So I guess we'll begin. And I want to first thank everybody for joining us today for the third and final webinar in the eCOVID RecMap series. My name is Ashley Motilal, and I'm a research assistant at Cochrane, Canada. And today I'm joined by Rana, who will be giving the second half of this presentation today. So today I'll be taking you through the plain language recommendation component, particularly to explain what are plain language versions of recommendations, how are they developed, and how can you access them on the RecMap. So for my disclosure, I would just like to state that I'm employed by McMaster University as a research assistant. And for our objectives for today is to learn what plain language recommendations are and why they're important, to learn about the various steps that plain language recommendations go through before they get published, to learn how to access a PLR on the eCOVID RecMap, and finally, Rana will explain more about the randomized control trial surrounding the plain language recommendations. So to start this webinar, I'd like to launch a poll question for everybody. So this is the first part of the CDC guideline on the Pfizer vaccine for children ages 5 to 11 years old. And let's say you handed this page over to your grandparent or a member of your family, how likely would they understand it? Very likely, likely, don't know, not likely, or will not understand at all. Okay. So it looks like we got some answers coming in here.
Yes.
Great, thanks, Sahara. So we'll give it about 2 to 3 more seconds. I think that's everyone who answered. So it looks like most people answered not likely or will not understand at all. Okay, so I'll share the results here. Okay, so that is expected because over the past 2 years, we've seen a substantial increase in COVID-19 research and guidelines that has been published through different sources like television, social media, and journal articles. And this meant that the general public was faced with a large amount of overwhelming amount of information and also complex terminology that might only be understandable to people with a healthcare background and a university background. And at the end of this, we expect the public to make decisions about their own health. So they might have questions like, how can I protect myself against COVID-19? Should I get the Pfizer-BioNTech vaccine? And what are the treatment options for COVID-19? So what our team has done is we've taken these guideline documents that can be very lengthy and filled with scientific jargon. So for example, one of the recommendations from these guideline documents is vaccination with BNT162b2. And we take it through a multi-stage editing process. And then we create something called the plain language recommendation, which is a lot more easily understandable for public stakeholders. So what is a plain language recommendation? It's an easy to read summary of up-to-date published and quality checked recommendations from guideline development organizations. It's a balanced statement that includes an explanation of the recommendation, what it means for the patient and the public, as well as a connection to the guideline source. And they're also accessible for everybody, but is curated for patients, caregivers, and the public. So some of the purposes of the PLR is that it helps to highlight the evidence of the benefits and the harms of an intervention, as well as point out uncertainties which can help with decision-making and help patients recognize their own values and preferences. PLRs can also help to promote self-care and encourage patients to manage their own conditions. And it also prepares the public for a visit with their healthcare professional and can foster a trustworthy patient-clinician relationship. So what do we already know about plain language recommendations? One study to highlight is a focus group that was conducted by Cochrane Canada researchers to obtain the attitudes, perceptions, and understandings of recommendations by the public. The key points that emerged from this study and that led to the PLR template that we have today was that participants wanted to be informed about who the recommendation applies to. They wanted to understand the strength of the recommendation, so what it means to be strong or conditional. They wanted to know how to use this recommendation in their daily lives. And they also looked and wanted advice and topics to discuss with their healthcare professional. And we also have many existing resources and tools that help us create and evaluate written plain language material. So one of these is the GIN Public Toolkit, which is a chapter freely available on the GIN website and contains evidence-based strategies for communicating recommendations to patients. It's very useful for learning about how to design material for patients, for example, what color or format to use in patient materials, and also contains the content that should be included in patient information. And lastly is the Discern checklist, which we've used to develop our current PLR format. And it's an instrument of 15 key questions that assesses written consumer health information. And there's 3 sections to discern. One is the reliability and the trustworthiness of the publication. It also evaluates the quality and the details of the information. And at the end of it all, you can give the patient information an overall rating. So now knowing all of this, we can go over an example of a PLR. So this PLR is about the Pfizer vaccine for children who are 5 to 11 years old. So in our PLRs, we always start with the clinical question, which contains the PICO elements in question format. And if you're not familiar with PICO, it stands for Population, Intervention, Control, and Outcome. So in our example here, the population would be children aged 5 to 11 years old. The intervention would be Pfizer vaccine, and the outcome would be prevent COVID-19. The next part of the PLR is the recommendation text. So it's the original guideline statement that's translated to plain language. And based on the Discern checklist, there's important things that you need to include. So one is the guideline organization, so the organization that's making the recommendation. The link to the evidence, so we attach the eCOVID RecMap link, and also the publication dates. The next section is who is this for? And this will describe the population who the recommendation is applicable to. So in this case, it's children aged 5 to 11 years old. And based on previous research, we've learned that it's very important to put the population higher up on the template because users will often ignore recommendations if it doesn't apply to their individual circumstances. And the next section is recommendation strength, which includes a visual for strength. So in this case, the solid circle means strong, whereas a circle with lines through it means conditional. And it also contains a definition that describes a strong recommendation and a conditional recommendation. So this is the other part of the PLR. And on the left, it says why strong. So this will give you an explanation about the strength of a recommendation. So it contains the rationale for why the recommendation is strong or conditional, and it considers the balance between the benefits and harms of the intervention, as well as other factors that contributed to this judgment. We also have the additional information section on the right-hand side, which contains important information that the population should know. It considers the values, acceptability, cost of the intervention, and implementation considerations. Does this vaccine include 2 shots in the arm? That's the type of information that would be included in this section. And then below that, we have the benefits and the harms. So the users can also read a brief summary of the benefits and the harms of the intervention. So what does the vaccine, what's its effect on symptoms, on mortality, on hospitalization? That's the kind of information that would be found here. And then users have the opportunity to explore the benefits and the harms by numbers through an interactive drop-down table. And this table is called Interactive Summary of Findings Table. And it includes a summary of the results and the certainty of the evidence that are considered when making this recommendation. So what our team has done is we've developed the statements in the second column in blue, and we've used Grade Guideline 26. And this paper provides guidance on how to communicate the size of the effect, so the impact of the intervention on the outcome, as well as the certainty of the evidence, using simple words and appropriate terminology. And the last section of our PLR really emphasizes what the patient or the reader can do. So the What You Can Do section outlines self-management tips and actions that the population can take, such as visiting reputable websites and who to speak to. And the Talk with Your Healthcare Professional section outlines topics that they can discuss with their provider, such as what are the vaccine side effects and how well this vaccine will protect you. So now that we went over a PLR example, we can go over how they're developed. And it takes a huge team and a huge development process to make that happen. So to begin, we have multi-stakeholder engagements and meetings where we have clinicians, guidelines, academics, members of the public who come together and discuss priority topics. So priority topics can be emerging topics in the news. For example, right now, one of our priority topics is dealing with the Omicron variant. So these topics, after these topics, we have our team prioritizes the COVID-19 topics for plain language recommendations, and we consider a few things. So one is the list of recommendations available on the RecMap, as well as interest to citizens as judged by two large research teams. So one is our executive team, and another is the implementation team, which includes different types of stakeholders as well. After this, we select a statement on the RecMap that aligns with our priority topics. And there are 3 different types of statements that we can select from. We have formal recommendations, good practice statements, and additional guidance statements. And we've prepared different Google Docs based on this categorization. And this is because each of these statements have their own set of criteria, and we want to ensure that our team will be able to communicate this clearly. And we also use the Google Docs platform to prepare PLRs because it offers a collaborative platform in which we can resolve disagreements easily. So then this document is taken to somebody who drafts the content, and they will use training resources that are provided by our team to select appropriate information to include in each section. And they translate this information with the assistance of plain language resources. And I'll take you through 3 of these resources that our drafters use and that are also free and accessible to you as well. So one of the apps that the drafters use is the Hemingway editor. And it analyzes the readability of the sentences by detecting complex terms. It can detect the use of passive voices, phrases that might have a simpler alternative, sentences that are hard to read and that are very hard to read. And at the end of it, it produces a readability score. So our goal is to aim for a grade 9 to 10 readability score, since at this literacy level, it provides an easy to read PLR that doesn't lose its intended meaning. Drafters also have the Plain Language Dictionary from the University of Michigan, which offers plain language definition alternatives. So for instance, hypertension. Instead of using the word hypertension, our drafters might want to use the word high blood pressure. And this is included in the definition as well. Instead of the word obese or obesity, they can use the term dangerously overweight. And instead of the term thrombosis, they can also use the word blood clotting process. And then our drafters also get the Get It glossary, which is also available on the eCOVID RecMap. And it's very similar. It allows the user to find plain language definitions of health research terms. So instead of using a word like randomized controlled trial, they might want to use a word randomized study. And this also provides a plain language definition of what a randomized study is. So then this gets sent to checking. And the checker will ensure that the drafter has selected the right information and that the information was drafted using simple terms. Then this gets sent to a citizen editor. And right now we have 3 high school students who look at the PLR draft for readability and ensure that it's concise. And we provide this team with the same documents and resources for use. The citizen editors can also make edits and leave comments for the medical editor. And then finally, this goes through medical editing with Dr. Kevin Potty, who is the main investigator on the trial. And he makes sure that the recommendation has retained its original meaning, that it's complete, nuanced, and unbiased. And he makes the final decisions regarding the draft. And then finally, this goes through copy editing and publishing through our GradePro software. And once that's done, it gets uploaded to the eCOVID map. So since we went through the example, we went through the processes, I like to also launch my last poll for everybody. So I have two sentences here, and I'd like you to choose which passage is more appropriate for the public. So I think, Dahara, if you could launch the poll. Okay. We have some answers coming in. We'll give it about 10 more seconds. Okay, I think we could end the poll there. It looks like everybody was correct. It's passage number 2. So I'll stop sharing. So it is passage number 2. And you can see that it uses, it's a shorter phrase. It uses, instead of the word anxiety, it'll use words like fear or worry. And most importantly, it has a grade 9 readability score, whereas the one on the left has a postgraduate reading level. So great job. That's awesome. So, so the last part of my presentation is how can you access plain language recommendations on the RecMap? So once you visit the eCOVID site, it's very simple. You want to click on the link below the search bar that says, see the recommendation with plain language versions available. And this will bring you to a list of recommendations to choose from. And all of these recommendations will have a PLR attached to them. So you just need to click on a recommendation of your interest. So once you click on that recommendation, it'll bring you to the recommendation details page. And you can scroll down and you'll see a number of tabs here. And one of them is called plain language recommendations. So once you click on that tab, it will reveal a link that says, click here to access the plain language recommendation in English. And when you click that tab, you'll reveal the PLR and you're able to look at the PLR and its information. So it's a very simple process. And we also have our PLRs available in different languages. So we have up to 10 other languages available on the RecMap for several PLRs. We're translating to French, Spanish, Italian, Chinese, German, Czech, Slovak, Tamil, Hindi, and Greek. And we're soon going to upload our Arabic and Persian PLRs. And these translations go through a very simple process as well, where we take the English version of the PLR that's already published. It goes through a translation software like DeepL or Google Translate. But these translation softwares are not perfect. So we need to give it to somebody who speaks the language. So this gets reviewed and edited by our translators. And then after it's reviewed and edited, it gets sent to me. And I'll take the translated draft through GradePro and upload the translated version. So in summary, the 3 key points that you should take away from the first part of the presentation are that PLRs are easy to read summaries of up-to-date, published, and quality-checked recommendations from guideline organizations like the WHO and CDC. The PLRs go through a multi-stakeholder process before it's published on the eCOVID RecMap. And you can find our PLRs, including translated versions, on the eCOVID RecMap by following the link on our homepage. Now, we have 32 PLRs available on our map right now, so I encourage everybody to go to covid19.recmap.org and take a look at them. Okay, so that's the end of my presentation here. I'll stop sharing and I'll give it over to Rana.
Thank you, Ashley. I will share my screen. Just to confirm, Dilhara, you can see my screen, right? Yes. Thank you. Hi, everyone. My name is Rana. I'm a research coordinator at McMaster. And through this second part of the session, I will be talking to you about our plain language recommendation trials. I will start with my financial disclosure. I'm a research coordinator employed by McMaster University. So through this part of the session, I will be informing you about our 3 randomized control trial, where we will be testing the plain language recommendation format with 3 populations: adults, youth, and parents. First, I would like to introduce you to our trials lead. We have Dr. Kevin Putty from Western University leading on the adults trial, Dr. Lisa Hartling from University of Alberta leading on the parents trial, and Dr. Martin Ofrenga and Dr. Nancy Butcher from University of Toronto and the Hospital for Sick Children leading on the youth trial. So what is the objective of our trials? Our aim is that through these 3 trials, we will understand how the optimized format of the plain language recommendation affects how the public understands and interprets the information in a recommendation. So to reach that, we will be selecting developed plain language recommendations, optimizing their format and testing them with the 3 populations, and in the aim of improving the way we present our guideline recommendations to the consumers. So our project consists of 3 different phases. The first phase is the pre-trials pilot work, and this is mainly consists of involvement with consumers and stakeholders from the adults, parents, and youth groups. And I will talk in a second about what specific activities these consumers were involved in. The second part is conducting the 3 randomized controlled trials with the 3 populations in order to measure our primary and secondary outcomes. And later during my presentation, I will be sharing with you more information about the methodology of our trials. And the last and third part is the qualitative interviews. We will be giving participants from the trials opportunity to participate in a semi-structured interviews so they can give us more feedback on the PLR format, and we can better contextualize our trials results. So to start with the first part, the pre-trials pilot work, we had adults, parents, and youth consumers and stakeholders invited to take part in several meetings and workshops. During these meetings, the consumers were able to participate in activities and give feedback about 4 main components in our trials. The first component or the first activity was prioritizing the plain language recommendation topic to be tested in the trials. Here, the consumers gave us feedback on which topics we should include in the trials, and this was based on the relevance and priority of the topic for the specific population. And I would like to note here that in each trial, we will be using 2 different recommendation topics. The reason for doing that is first to make sure that the participants' answers is not influenced by the topic of recommendation tested, and also to make sure that our results are generalizable. Moving to the second activity, it was optimizing the plain language format. And here we shared the plain language recommendation template, which you just saw with Ashley. And the consumers gave us feedback on how to better present it and enhance the way we put the information in the template. The third activity was giving feedback on the survey instrument and pilot testing the survey to make sure everything logistically works well, the length is not too long, and the questions are clear. And finally, the fourth activity was giving us feedback on our recruitment material, specifically our recruitment flyer material. So one of the main activities that the consumers and stakeholders were involved in was to optimize and better enhance the way we present the plain language recommendation summary. For this reason, we have introduced or tweaked some of the features on the plain language recommendation. And here I'm presenting an example of the adults optimized plain language recommendation template. As you can see, there were some changes to the background colors, to the font, and to the order of information. You can see that we start with the target population and then state the recommendation. Also, another important introduction to the template was introducing a separate section for evidence summary, where we present the plain language statements for each outcome. In this picture, you are seeing the example of the optimized PLR template for the youth and parents. As you can see, similarly, there were changes to the colors and fonts. Also, we have introduced some visual images. We've enhanced the way we present the visual for the recommendation strength. We've introduced a navigation bar on the right so that the reader can move from one section to another easily on the template. Similar to the adults, also a separate section for an evidence summary was introduced, slightly different in the format, where we list the outcome in a table format, next to it the plain language statement and the certainty of evidence. Now, this was it for the first phase of our work. The second phase is introducing you to the methodology we are following and implementing in the 3 trials. So as you already know, our 3 main target populations are youth, parents, and the general adults. The youth are defined as individuals who are between the ages of 15 and 24 years old. Parents are defined as individuals who are 18 years and above and are parents, legal guardians, or caregivers of children who are under the age of 18. And the general adults are defined as individuals who are 20 years old and above. For eligibility, the participants have to fit the age category of their respective population, and they should also be able to read and understand English in order to complete the survey. We do acknowledge that there is some overlap in the age categories across the populations. So this is why we will be limiting the participation of each participant to only one of the trials. And it's also good to note here that this is open for global participation and there's no limit to any country. For our intervention and control, the intervention is the optimized plain language recommendation as optimized by each population. And the comparison will be the standard language recommendation. And here we define the standard language recommendation as the original recommendation as it was originally published and found by the guideline organization. So our trials will be running online and we will be using 3 different site links to recruit participants. And to help us reach more participants and reach our target sample size, we will be recruiting through the help of our experienced investigators, co-authors, and network, and in addition to social media campaigns. Our survey will be implemented on SurveyMonkey, mainly because it allows us to use the concealed allocation code for randomization. And participants will be randomized in a 1-to-1 ratio, either to the intervention or to the control. So what is our hypothesis in these 3 trials? We hypothesize that there is a difference between the optimized plain language version and the standard language recommendation. And to be able to prove this difference, our target population was calculated to be 240 participants in each trial. And participants will be recruited to 120 in each arm. So 120 will view the plain language recommendation, which is the intervention, and another 120 participants will view the standard language recommendation, which is the control. For our outcomes, we have 1 main primary outcome and 4 secondary outcomes. The primary outcome is understanding, which is defined as the correct comprehension of key guideline information. For the secondary outcomes, the first one is accessibility and usability, which is defined as the ability to navigate the page that represents the information of the recommendation and be able to use this information. The secondary outcome is satisfaction, which is defined by the participants' impression of the way we present the recommendation. Then we have intended behavior, which is defined as the participants' willingness or intention to adopt and follow the recommendation in the way it is presented to them. And the final secondary outcome is preference, which is defined as the participants liking one format more than the other. For our statistical analysis, we are planning to conduct an interim analysis, and this is mainly for the sake of checking for any potential interaction. Because we are using two different recommendation topics, we want to make sure that there is no possible interaction. And at the end of the trials, we will be conducting descriptive analysis to summarize the participants' background and demographic information, and in addition to inferential analysis to check for differences in the outcomes between the two groups. It's also important to mention here that in these analyses, we will be controlling for demographic variables. And also in our third survey, we will be asking questions regarding English proficiency level and familiarity with COVID-19 health information, which are two variables that we will also be controlling for in our analysis. In the following diagram, you will see the flow of our trial work. So first, the participants will be invited to be enrolled in the randomized control trial. Then they will be screened for eligibility. At this stage, they are asked questions about their age category and whether they are comfortable to fill the survey in English. They should satisfy both questions to be able to be enrolled in the trials. Then we ask a question about the region the participants are filling the survey from. And really the main reason for asking this question is to stratify participants based on region. And the intention from doing that is to make sure that participants from each region get an equal chance of viewing either the intervention or the control, as opposed to having for example, all participants from Europe just viewing the intervention. Certification will ensure that they have a 50-50% of viewing either. So after certification, the participants will be randomized to one of the two recommendation topics we are using in the trial. So either recommendation topic 1 or recommendation topic 2. After they are randomized to the topic of recommendation, they are randomized to the either intervention, which is the plain language recommendation, or to the standard language format, which is the control. At this level, the participants are viewing one format of the recommendation and will be filling out a set of questions, answering a set of questions that are multiple choice and Likert scale questions to answer and address our outcomes of understanding, accessibility and usability, satisfaction, and intended behavior. After this part, there's disclosure of the other format. So for example, if a participant was viewing the standard language format, they will be able at this stage to view the plain language format. They will be able to view both formats, compare them, and then answer the questions related to preference. And finally, the last set of questions in the survey addresses the demographic and health literacy background. So we've covered the second part of the RCTs regarding the methodology we are following. Now for the last and third part of our work, which is the qualitative interviews. We will be giving participants from the trials an opportunity to participate and take part in a one-on-one semi-structured interviews. We aim to invite 12 to 18 participants from each trial. And these interviews will be audio taped and transcribed. And then these transcripts will be reviewed and read to identify main recurring codes in order to identify the main themes that are coming out from the interviews, thus following a thematic analysis. The aim of these qualitative interviews is to give us more insight and more feedback on how the consumers and the public would like to see the plain language recommendation, and it will help us contextualize our trials result, and ultimately enhancing the plain language recommendation format we have on the RecMap. So in summary, where we are at now, we're currently obtaining our ethics approval to start recruitment, and we aim to publish our results by when the trials are finished, and we would like to publish them and share them in future webinars and workshops. We would appreciate if you can follow us on our social media accounts so you can always stay up to date on our work on the RecMap, our plain language recommendation work, and our trials work. Thank you so much for listening, and I guess we can open it up for questions now.
Seem like there's any questions? One. I do have a question here. So are previous presentations in the series available for viewing? Yep, so the ones in the presentation right now are available on the RecMap. So you can visit covid19.recmap.org, sorry, or .com, and sorry, .org. So, and then filter it by the plain language recommendations, and you'll be able to see the PLRs that were presented in our presentation. Okay, any other questions for Rana or I? Okay, doesn't look like there's any other questions. So I guess we'll end it quite early. But thank you so much, everyone, for joining. This has been really fun. It's been a pleasure.
Thank you, everyone.
Thanks, everybody. Have a great rest of your day.